hours. Joining us now, New York Democratic Congressman Max Rose, who just returned from a deployment with the National Guard to assist in coronavirus response and preparations on Staten Island. Last time we spoke to you, you were on Capitol Hill, I think helping to pass the stimulus legislation. Now you've been just out building a hospital or converting a hospital that was designed for their purposes into a coronavirus center. Take us through what you've been doing and what you've been seeing and hearing.
Absolutely. So thank you for having me. What I did over the last few weeks, first of all, pales in comparison to the incredible service that I saw displayed by our frontline medical professionals and our men and women in uniform. I served with doctors who had just recently lost family members and who also had family members in the ER, in the intensive care, and still were working 18-hour days. Nurses who hadn't even had the opportunity to hug their children in over a month because they were self-quarantining out of fear of getting their own family sick. And each and every day they held their head high and they got the job done. Soldiers who had basically deployed. They were staying on Staten Island away from their family, standing up this hospital. So we stood up one of, if not the first, nationwide state-run COVID-only hospital facility that was designed to be pre- and post-ICU COVID treatment to try to take down some of the excess capacity that our hospitals have been dealing with, that they're operating 300%, over 300% capacity. And what we found is that in order to attack COVID, it requires highly integrated hospital care. A bed is one thing, but you have to, alongside that bed, you need medical professionals and intensive equipment like air concentrators. But we also found that we can get the job done. We stood up this facility in 6 days. 6 days. That tells you everything you need to know, not just about this city, but about this country. What we are capable of when we put our mind on a singular mission and not on our own divisions.
Congressman, does it seem disconnected from what is a lot of bluster at best and a lot of political recriminations and blame game from the Oval Office at worst?
Well, look, politics should have nothing to do with this. Let me make this very, very simple. And I say this as a Democrat. Nothing would make me happier than to see this president stand up, assert the full powers that he has at his disposal as the commander-in-chief to win this war. This requires total war. Total war, okay? We've spoken quite a lot about the Defense Production Act, but it also requires the utilization of the military. It requires the utilization of all elements of society. FEMA completely forgiving any amount that states have been asked to spend. And we don't need any theatrics right now, and we certainly don't need any finger-pointing. We need empathy on top of all of that. And if the president asserted his full power as commander-in-chief and we beat this virus and then he wins re-election, you know what? So be it. So be it, because we have emerged beating this virus. That is all we are asking. People's lives are on the line. Their lives are on the line right now. And the federal government can do things that the city cannot do and the state cannot do. Everyone's very open about that. We've got the city and the state competing with other cities and states across the country for PPE. They're competing with them for medical equipment, competing with them for medical staff, and they're going to be competing for lab reagents as well as for antibodies, unless the federal government steps in with a real plan and with real resources. They're the only ones that can do that, just like the federal government and the United States of America was the only one that could storm the beaches of Normandy. It was only the United States of America could send a man to the moon, be the first ones to do that. It wasn't individual cities, individual states that did that. The United States of America that won the Cold War, and it is only the United States of America that can unite and beat COVID. Individual cities, individual states, they cannot do it alone.
Well, as we've been talking, Donald Trump has announced just that individual states will be left to bring their states back alone. What do you think that looks like for New York State?
Well, look, I remain hopeful that the federal government will still have to remain hopeful, that the federal government will step in and provide additional resources. But with that being said, in order to open the economy back up, I believe that it is connected to very specific things. One is a dramatic expansion of testing and availability of antibody testing as well. Two is a continued change in social behavior. Until we get a vaccine, we have to change our social behavior for the long term, particularly around long, expanded mass gatherings. And then lastly, we have to keep an infrastructure, a healthcare infrastructure in place in the event of a future surge of patients. And if we can do those things, we can progressively open our economy back up. But all the while, let me close out by saying this. We have to have empathy towards and be there with real resources towards people that are suffering right now economically. We can't just theoretically talk about a distant opening of the economy without being there for people in a real and robust way because they're suffering.
They sure are. Congressman Max Rose, thank you for your service and thank you for spending some time with us. We're grateful.